Mostly, my name is Akia, and I'm going to be your nurse practitioner today. What brings you in?
Just came in for an annual physical today.
Okay, alrighty. All right, annual physical. Tell me, how old are you?
I'm 51.
51 years old? Okay. Tell me, describe your health to me. Do you
My
have
health,
any issues?
I'm very healthy.
Okay.
I have 2 children, 21 and 25, and very healthy.
Okay. Any kind of childhood illnesses? Did you have
None.
any? None. Okay. Any kind of major adult illnesses or conditions right
No.
now? Okay. Any allergies?
None.
To food, drinks, medications?
No.
None. Seasonal? None.
No.
Okay. And you take no medications?
None.
Okay. Any injuries?
None.
No injuries. Okay. And any hospitalizations?
Only the birth of my 2 children.
Okay. And were those
Healthy.
C-section or
Natural birth.
just okay? Okay. Tell me about immunizations. Are you up to date on those?
Very up to date.
Okay. Have you had your flu shot for the season?
Yes.
Okay. Have you ever had any kind of transfusions? Any blood
None.
transfusions? Okay. Iron transfusions?
No.
No. Good. A screening exam. So are you, tell me the last time you had a pap smear.
3 years ago.
2020? Okay.
Yes.
And what about your mammogram?
Just had one.
Okay. And have you ever had to have, when's the last time you had your labs checked? Like cholesterol level?
Just had them last month.
Last month? Okay. Alrighty. And you've also had your hearing test and all of that done
Yes.
recently? Okay. Tell me, any kind of psychological or psychiatric issues?
No, none.
Okay. And just tell me about your family history.
My mother died of breast cancer. My dad had open heart surgery.
Okay.
Yeah.
When did your mom have breast cancer?
60.
She died at 60?
Yes.
Okay. Alrighty. And your father, he had an open heart surgery. What age was he?
Last year, 70.
He was 70 years old?
Yes.
Okay. Any other issues with him?
No.
I guess he has heart disease then? Since he's had the cabbage?
Yes.
Okay. Well, cabbage is what we call open heart surgery. Any siblings?
I have 3.
Okay. Any of them have any ailments?
No.
No ailments for them? Okay. Any kind of genetic disorders for you?
No.
Okay. Just the your mom had the breast cancer?
Yes.
Okay. And you told me that she died at 60.
Mm-hmm.
And do you classify yourself with what's your race that you classify as?
African American.
Okay. Alrighty. Alright. And tell me, where were you born?
Charleston.
Okay. And tell me, in regards to your childhood family, your parents were married?
Yes.
Okay. And what's your level of education?
College.
Did you finish?
Yes.
What do you have your degree in?
Business.
You have a bachelor's?
Yes.
Business. And are you currently married?
Divorce.
And how are you dealing with the divorce?
Great.
Okay. How many years ago was that?
13.
Okay. And what do you do for a living?
Program specialist.
Okay. And how long have you been doing that?
13 years.
You've been doing that for 13 years? Okay. And do you like your job?
I love it.
Good. Would you say does it cause you any kind of stress?
No.
No? Okay. And tell me, are you around any kind of like hazardous environmental
No.
toxins or anything like that?
No.
Okay. All right. What type of home do you live in? An apartment, a
Single
house?
family ranch.
Okay. And do you own that home?
Yes.
Okay. And do you have adequate heating and airing?
Yes.
Okay. And do you feel safe in your home?
Definitely.
Okay. And you live in a neighborhood?
Yes.
Any stairs in the home?
No.
Okay. And you have like adequate like alarms for
Yes.
smoke and all of that?
Yes.
No issues there?
No.
It looks like I saw you walk in, so you walk okay, no assistive devices?
Yes. No problems at all.
So in regards to, you have enough money to get, like to buy your food
Yes.
and clothing, any kind of necessities you're
Yes.
able to get? Okay. And what about your access to healthcare? Do you have health insurance?
Yes. I have Blue Cross and Cigna. Yes.
Okay. And you go to the doctors, okay?
Regularly. Yes.
Okay. And one thing that I did forget to ask you, you said your mother had breast cancer. When was your last mammogram?
Last year.
last year. About what time of the year was it?
It's November.
November is when you had it. Okay, good. Alrighty, and tell me about your diet.
Just a regular, well-balanced meal, like breakfast, eggs, toast, lunch, salad, dinner, chicken and a sweet potato, and a vegetable.
Okay. Do you drink any kind of coffee or?
One a day, a cup a day.
One coffee a day. Okay. And what else do you like to drink? Drink any water?
I drink 6 cups of water a day, and I have 1 red glass wine weekly.
Any other alcoholic drinks do you do?
No.
Okay. Any substance abuse?
No.
Okay. Do you use a lot of salt and sugar
No.
and seasonings? No. Good. And tell me about your activity level.
I'm very active. I walk a lot.
So you walk every day?
Yes.
And how's your sleep?
Great.
About how many hours of sleep do you get a day?
6 to 8 hours.
Okay. Any kind of night sweats?
No.
Okay. Anything that kind of alters your sleeping pattern?
No.
Do you have difficulties falling asleep?
No.
Okay. Alrighty. And let's see. In regards to your sexual health, are you sexually active right now?
No.
No. Okay. No concerns there that you need to talk to me about?
No.
And who's your social support?
My children.
And how involved would you like them to be in your care?
Very involved.
Any kind of stress in your life right now? Anything
No.
you want to talk to me about? Okay. And when's the last time you traveled?
Last month I went to California.
California last month. Okay. Okay. What do you like to do in your free time?
Shop.
Any cultural or spiritual beliefs that would impact your care while you're here?
No, I'm just a Christian.
Okay, good. And are you in the military at all?
No.
You didn't mention that. Okay. Ever served in the military?
No.
Tell me about your general health. So, any weight loss or weight gain recently?
No, everything's been steady.
Okay. How's your appetite been good?
Great.
How has your energy level been?
Great.
Any night sweats or fevers?
No.
Okay. Any kind of changes with your skin? Any rashes, itching,
None.
moisture, dryness, texture changes?
No.
Any hair growth or loss?
No.
Okay. Your eyes, any kind of double vision?
No.
Any sudden vision loss?
No.
Any blind spots or pain?
No.
Sensitivity to light?
Mm-mm.
Are you seeing any spots or any
No, not at
floaters, as
all.
we would call it? Okay. Any with your ears? Any pain?
No.
Okay. Have you ever had any kind of ringing in your ears or balance issues?
No.
Okay. Any kind of nosebleeds do you have?
No.
How often do you have colds?
Not at all.
Okay. And have you ever had any kind of obstruction to your nose? Any
No.
drainage, pileups, sneezing?
Mm-mm.
Any postnasal drip?
No.
Okay. Do you wear any dentures?
No.
Okay. Ever had any kind of lesions in your mouth?
No.
Any issues with your gums?
No.
Your teeth are okay? You see the
Yes.
dentist regularly?
Yes.
And I can tell that your voice isn't hoarse or anything like that. You don't have any difficulty articulating your words.
No.
Do you get sore throats often?
No.
Any kind of chest pain?
None.
Difficulty breathing?
No.
Any palpitations with your heart?
No.
And you said no difficulty breathing at all?
Mm-mm.
Not with changing positions, not with
No.
doing activities or anything like that? Any coughing, wheezing,
Mm-mm.
anything like that? Good. Okay, you said your appetite has been good. Any
Yes.
kind of difficulty swallowing?
None.
Any kind of indigestion when you eat or anything like that?
Nope.
Okay, any kind of stomach pain?
No.
Heartburn?
No.
Constipation, diarrhea?
No.
Do you use the bathroom well?
Regularly, yes.
Okay, you regularly go to the bathroom? Okay. Have you noticed any kind of blood in your stool?
No.
You haven't coughed up any blood either,
No.
have you? Okay. And let's talk about your urinary system. Any kind of difficulties voiding?
No.
Any kind of burning on urination? Is it
No.
difficult to go? Do you feel like you're properly emptying your
Yes.
bladder? Okay. Any kind of blood that you notice in your urine?
No.
Okay. Alrighty. And you've had a last pap smear, you said. When was your last pap
3
smear?
years ago.
3 years ago. Okay. You told me that you get your breast exams done.
Mm-hmm.
Have you do them yourself as well?
Yes.
You do the self breast
Yes.
exam, and you had your mammogram last year. Any kind of pain or swelling to your legs?
No, not at all.
Okay. Any limited range of motion, or you walk
No.
okay?
Well, fine.
Okay, good. Any kind of headaches, lightheadedness?
No.
Okay. Any kind of sensory changes, changes in your mentation?
No.
No issues with nerves, numbness, or tingling?
Mm.
No? Okay, good. How has your mood been?
Very good.
Very good. Any depression?
No.
And you've never had any kind of suicidal ideations?
No.
Okay. So no history of like domestic violence or anything like
Nope.
that with your last marriage?
No.
Okay. All right. Perfect. Okay. I think that's about it
Okay.
for the comprehensive side. Then we're gonna go ahead and get into our physical assessment.
Okay.
So I'll do a head to toe assessment of all your body systems,
Thank
just
you.
to kind of make sure that we check you out well for your physical exam. Okay.
Okay. Thank you.
All right. You're welcome.